Thank you for sticking through the final conference day. I know everyone's probably tired, but still full of some energy from all the learnings and networking. I just want to make sure everyone's in the correct room, especially since this session was originally listed for yesterday. So we are currently in RUH4, which is Safer and Low Barrier Access to Services in Encampments. Insights about health and safety perspectives to improve service delivery. So I just want to make sure everybody is in the right room. If not, you can sneak out, or I highly recommend you stay because this is going to be a super cool session with really great information. Before I introduce our speakers today, I just want to start off with our local land acknowledgement, and I got to put on my glasses. We'd like to begin our session with acknowledging that the Canadian Alliance to End Homelessness 2025 conference is taking place on unceded Indigenous lands. The I gotta say that better, I practiced. The Ganingahaga nations is recognized as the custodians of the lands and waters in which we gather today. And the Jojage, which is colonially known as Montreal, is historically known as a gathering place for many First Nations. And today it is home to a diverse population of Indigenous and other peoples. We respect and continue connections with the past, present, and future in our ongoing relationships with Indigenous and other peoples from coast to coast to coast. So today we have with us Toronto and Peel region. Isn't that amazing? They will do a more detailed introduction of themselves, but I will introduce Erin Miffin is sitting next to me from Peel region. Beside Erin is Cassandra Carlson from Peel region. And then we have LOFT Community Services from Toronto. So we have Jenna Davis from LOFT Community Services and Ryan White from LOFT Community Services, Toronto. So a great lineup today. Thanks so much. I'll stop and I'm going to pass it over to our presenters. Sorry. I just want to remind everybody during questions, make sure you speak in the microphone here in the center of the room so that your questions and the discussion gets recorded for those who want to go back and listen that couldn't make it today. Also, if anybody would like the microphone brought to them, like I'm happy to do that. We have another helper in the room that can help us. So just kind of like raise your hand or tap me, let me know, and we'll bring the microphone to you. Sorry, thanks.
Good morning, everyone. How are we doing? Thank you for coming to the last day. We appreciate it. My name's Erin Mifflin. I'm an advisor of housing innovation and program design at the Region of Peel in our Housing Services Division. Most of my work involves working on challenges and opportunities in our housing system. Very interesting work these days, as I'm sure you can appreciate. And my colleague, Cassandra Carlson, is a program analyst, AKA Regional Encampment Coordinator, and she'll get into more of what that entails. But we are representing the strategic and operational perspectives of our encampment response. And we're delighted to be able to share the next step of our journey with you, a journey that has involved many different organizations and people and a lot of work. Today, we're going to talk to you about the highlights of our finalized council-approved response plan that has both strategic and ops, like I've said. This includes how our response teams ensure their actions are human rights focused, compassionate, and improve the quality of unsheltered citizens in our region, all while being mindful of surrounding communities and other dynamics. We're keen to share our successes and strategies about implementation, how it really works. We are going to share that with you. We think it's really important. And then how we take it back and have strategic conversations and make tweaks to ensure that we are delivering as good a service as we can under the circumstances and to pursue continuous improvement. First, a little bit about Peel for those of you in the audience who might not be familiar with our region. It's located just to the west of the city of Toronto in the province of Ontario. Within its boundaries, you'll find the city of Brampton, the town of Caledon, and the city of Mississauga. This means that Peel Region is a two-tier municipality. Within this two-tier framework, Peel is responsible for various program areas. One of those is affordable and community housing and homelessness. We support residents to get and keep affordable housing, and we help them improve their quality of life, and one of our goals is to reduce chronic homelessness in Peel. Peel is like most other places. We have an affordable housing and homelessness crisis. Since 2018, we've been working collaboratively with organizations to implement our 10-year housing and homelessness plan. Ending chronic homelessness in Peel is one of our desired long-term outcomes of implementing this plan. To do this, we will need more funding from our federal and provincial governments to create more housing and to prevent homelessness. Nevertheless, our coordinated encampment response is one action to transform service for our clients within this broader strategy. Homelessness in Peel has increased significantly, as it has many other places, and it's getting worse. While most people who experience homelessness in Peel stay indoors in our shelters or elsewhere, we do have a relatively small population of people who live unsheltered in encampments. Our data shows that to be approximately 8% of our total homeless population. We realize that encampments are symptoms of gaps in housing, income, and health supports, and our collaboration seeks to provide the best service possible in the face of these systemic challenges. Some of you may have attended our talk last year in Ottawa at the conference. We're about halfway through our journey of creating a coordinated encampment response. We got a lot of interest, especially from other local governments. So we felt it was important to come back this year to finish our story. We're proud of the progress that we and all of our partners, most notably CMHA Peel Dufferin, and we have representation in the back, so shout out to you. Municipal staff from Brampton, Caledon, and Mississauga, Peel Regional Police, and others. We've made a lot of progress on a very difficult and hard situation. Tools for supporting successful implementation of a human rights-based encampment response are typically not widely shared publicly by governments. While this is understandable, given the polarizing and divisive nature of unsheltered homelessness and encampments in communities, Peel is committed to ensuring that our methods, activities, and outcomes of our coordinated response be transparent and accountable. We want to share our tools and our methods with you. If you find any of it useful in your own communities, we're happy to have that conversation. So, since last year, our collaborative has created and implemented a risk-based, balanced approach that assesses, monitors, and mitigates risks found in encampments. We have encampment response teams that are based in our local municipalities. Right now, that's Brampton and Mississauga, and they coordinate all the time. And Cassandra's going to get into how closely they coordinate. We have 6 elements of our response, including very comprehensive joint protocols. So for every situation, we have a protocol for that. Whose role is that? Whose responsibility is that? What are the key activities? What are the expected outcomes? And they need to be, given the number of people in this space and the importance of everyone respecting the Canadian Charter of Rights and Freedoms. Our collective goal is to reduce the risks and negative impacts of encampments for those living in them and for the residents and businesses impacted by them on the outside. Encampment residents are always encouraged and always supported to access housing and emergency shelter options voluntarily. These are our guiding principles that all our partner organizations decided on. Each encampment is unique and requires a rights-based case-by-case approach. We use data and evidence to detect, assess, and mitigate risks so we can make informed decisions, not based on rhetoric, okay? Like, you guys here all know that can happen very easily, so data is critical. Whenever possible, we encourage voluntary relocation of encampment residents, and we work hard to ensure that all reasonable supports have been offered. Our encampment response teams participate in weekly meetings and encampment site conferences. Those are smaller meetings where we're talking about more acute issues. Cassandra will provide more information. They visit encampment sites weekly to perform wellness checks and to monitor risks. They assess these sites for health and safety, develop action plans to mitigate and reduce the risks, and they support encampment residents first and foremost, but also the surrounding community. There are a lot of political dynamics to this response plan that we need to be mindful of. These are the steps our teams follow. The teams include staff from the region, Peel Outreach, Municipal Fire, Bylaw, Security, Parks, and Peel Regional Police. We regularly remind the public to direct all inquiries to 311, that's our local phone service, to ensure coordinated and prompt service. Each step is supported by the protocols that I mentioned to guide our decisions and ensure that everyone on the team knows their role and knows their responsibility. Decisions about how to manage an encampment are made by the property owner or custodian, the organization whose land the encampment is on. And there's where it gets tricky, because Peel Region does not own most of the land on which the encampments are located. Those are our local municipal partners. So it's very interesting dynamics, but our overarching role is always to support encampment residents throughout their entire encampment journey. The teams help residents transition to indoor options, and when this happens, public spaces can be restored to their intended use. This can happen for several reasons, such as residents have moved to emergency shelter or other housing options, and the encampment has become inactive, which means no one's living there. The encampment is removed because it's in a no encampment zone. More to come on that in the next slide. Or the encampment is removed because of other high risks that cannot be safely reduced. So these are our no encampment zones that all our organizations around the table developed. Encampments are not permitted in these areas, known as no encampment zones, and our response acknowledges that the removal process may be expedited in these zones because of significant, and I mean significant, health and safety concerns. They are either owned by the local municipalities in Peel or by the region. There are several types of non-municipally owned lands that are also considered to be no encampment zones, as they have a public purpose, but they differ in response because they are owned by non-government organizations that do not have the same charter obligations towards homeless individuals as governments. These lands include school board properties, as well as conservation areas and transit stations. These agencies, boards, and commissions have the option to decide how they want to respond to encampments on their lands, and they have been active participants in this work. It's been great to have their perspectives. The Mississauga and Brampton encampment response teams have been piloting the use of no encampment zones for several months. Early results show these zones keep the encampment response balanced with reasonable rules. When consulted, encampment residents said they easily understood and accepted these rules. Here's what happens if an encampment is found in a no encampment zone. Number one, voluntary relocation is always encouraged. And we facilitate that through arranging for storage, site cleanups, and shelter options. Number two, the land custodian will issue a trespass notice. Number three, removal day. Municipal and regional staff, as well as Peel Outreach, Peel Regional Police, will attend. Storage, cleanup, and shelter options are arranged, and the trespass notice will be enforced as required. And four, the site is remediated and monitored to ensure the site remains unoccupied. Our member organizations have endorsed and agreed to follow the direction and processes laid out in the policy and protocols. They respect the needs of people residing in encampments while balancing the needs of community members living and sharing the same community spaces while aligning with all applicable legal requirements. The overarching goal of our policy is to reduce risks, harms, and negative impacts about encampments on public lands in Peel. The protocols, as I've mentioned, are very operational in nature, and they're intended to be used by our encampment response teams, and they are. One of the joint protocols that often we get a lot of questions about is our removal and enforcement protocol. It guides our teams about what to do when an encampment in Peel could be removed and how the property owner should carry out the enforcement of a removal should they wish to do that. Before any enforcement action is taken, it's essential that we encourage encampment residents to voluntarily relocate. And Peel's role is to really help support and extend that phase for as long as we can to ensure that they get the supports we need. If the property owner deems that relocation is necessary or is desired by the residents, the relocation respects the human rights of the residents. Regular and early discussions help encourage meaningful engagement and participation. Removals are a property rights issue, not a criminal offense, Any illegal activities about encampments in Brampton or Mississauga are within the jurisdiction of Peel Regional Police. OPP, Ontario Provincial Police, handles Town of Caledon. To ensure consistency with the policy and protocols, as if we didn't have enough information, we actually didn't. We need like one more step. We have standard operating procedures. This is the final phase of designing our encampment response. We're doing that now for Peel staff. They're created by the project team and then they're validated with operations, people like Cassandra. We also share them with our partners if they want them to help them better understand the nuances of implementations that they're inevitable in every organization. You can really get into the weeds and you can get your wires crossed very easily. So our SOPs will be done by the end of the year to support full implementation next year. And speaking of implementation, this is what we aim for. But sometimes it feels like this. So Cassandra is going to take the mic now and she's going to talk to you more about all the minute details and how it actually works.
Okay, so just to get into housing services and their role. Housing services plays an important role in our response. We connect with encampment residents to offer housing, outreach, and shelter referrals. We're identifying needs and working collaboratively with residents to find housing or shelter that's suitable for them. The housing workers and myself connect closely with our Peel outreach team to work through any challenges, identify gaps, and determine some best next steps. As the regional coordinator, I am the conduit between outreach and the housing workers, ensuring that staff have the tools and resources and knowledge in order to be successful. And we're working to educate all staff on our protocols and policies and SOPs. And it's really important here to note that we are the experts in terms of the housing aspect, not in terms of any removals. So all we do is provide the information about the steps we're taking and advocate for the clients when needed. So partnerships, of course, are essential to our coordinated response. Partners will be signing a memoranda of understanding in order to formalize our roles and responsibilities, as well as highlight what our shared guiding principles are. Feedback is a critical component to our partnerships being successful and responding to community concerns with a balanced approach, especially from encampment residents themselves, since they're the ones that are most impacted by these processes. Frequent communication is essential for establishing and maintaining trusted and respectful relationships with encampment response partners as well. So Peel is supporting implementation with a number of things such as knowledge sharing for all new staff. We're developing key messaging and communication tools. Key messaging and communication has been really important, especially when we're on the ground and we're getting approached by residents and community members. So just ensuring that we have alignment in terms of our messaging. We also are providing various trainings and e-learnings. And importantly, we are funding our municipalities in order to ensure that they have adequate resources. So this is a little bit of an over-dramatic example, not so much of a typical work week, but more so typical tasks that I'm responsible for. Of course, every week looks different and the needs and demands are changing with it. So as previously mentioned, so some of my tasks include attending weekly encampment site visits, so both Brampton, Mississauga, and Caledon, as well as the weekly encampment meetings for all the municipalities. Juggling the needs of the municipalities has both been challenging and rewarding. The benefit is that I'm able to learn from both. They have kind of a different approach to the encampments. So I'm able to take away some of those strengths and share that with the others in order to develop even stronger practices. Coordination is a lot of work, but it does have tremendous payoff, and it helps us achieve better outcomes for people living in encampments. So just to go into a little bit more detail, so on a weekly basis in each municipality, we visit anywhere from 4 to 8 encampment sites in a day, depending, of course, on the needs, circumstances, and timing. Our hope is to visit each encampment site at least once a month. The purpose of our site visits is to assess the health and safety risks. So the partners that are on site are police, fire, there's a municipal coordinator, I attend as well as housing staff. Each partner completes a site assessment form in their section of it. So fire assesses fire hazards, police completes a section on unsafe practices and behaviors, and the municipal coordinator completes a section for interference and site compliance. And as I mentioned, we also are bringing housing workers on site, which is a really important additional people perspective in addition to the Peel outreach regular visits. We found that the housing workers on site has been really successful as it provides streamlined connection to residents who are often transient and not receiving consistent supports. So weekly encampment meetings, they're a great way for consistent collaboration and discussions. The structure of the meetings could change depending on what the needs and objectives are, but ultimately the goal is to bring all of our experts to the table and create an action plan and best next steps for each encampment. The weekly meetings also allows us to bring in any other relevant partners, so parks, animal services, Metrolinx, CN Rail, anyone who might be relevant. Meeting on a consistent and weekly basis really helps us all to feel aligned and connected to the ever-changing work. And in between these weekly meetings, we are connecting on a very consistent basis. We have anywhere from 10 email chains running on any given day. Oh, what did I do? Okay, so encampment cleanups. So a coordinated encampment cleanup is a collaborative action that we take to address identified health and safety risks, and we provide wraparound supports to encampment residents. So these cleanups feature the entire encampment response team, so housing, outreach, police, and fire, with the ultimate goal of reducing risks and encouraging voluntary relocation. The encampment cleanups work with residents to clean up their surrounding area. It's not a removal or relocation. It's really a strategic risk mitigation effort that we're doing. So outreach will go in advance and to let the residents know that we're conducting a cleanup and to provide them with garbage bags and have them remove any items that they're not interested in keeping. And then we have a contractor that comes in and removes it. So as previously mentioned, we have been launching encampment removals in the municipalities. It's very important to note that we've been really flexible during the implementation of the removal processes in order to ensure that we're taking the necessary steps, maintaining the human rights of the individual, and making continuous improvements through our learnings. Our processes are very individual as well as intentional. There's no set or rigid process. Each encampment is different, so we have to be flexible with it. So I wanted to provide 3 different outcomes to our removals that we've had in recent times. So in this first example, resident A had been in an encampment for over a year. They had no previous interest in connecting with housing or outreach, not sharing any details, and the municipality made the decision to issue the trespass notice and move towards removal. Once they were issued that trespass notice, and per our processes, outreach is visiting every day leading up to the removal. And then through those conversations, the resident was able to open up and share some of their concerns and barriers around shelter access. And on the day of removal, we were able to warm transfer them into shelter. So that was a successful outcome. In the second example here, we have an encampment that was to be removed and there was a date scheduled. During the weekly visits, the housing worker was able to make connection and make really great progress with the resident. And we were able to advocate to the municipality to hold off the removal to allow us to continue making that connection, because we felt if we were to remove at that point, we would displace them and we would lose all connection with the resident. So the municipality worked with us and allowed them and delayed the removal. And then through this, we were able to secure housing and move them directly from the encampment to housing. And then the encampment became inactive and we were able to go ahead and clean up that site. And then in this third example, we have an encampment resident who is not interested in working with outreach or accepting shelter housing. On the day of removal, they know that it's happening. They pack up their items and they say that they're moving along. This individual now has been relocated 3 times because each encampment that they're setting up is in no encampment zones, and the municipality has made the decision to remove them. So importantly, in these 3 examples, it shows some positive outcomes, but a lot of work that really needs to be done. We need to understand what our outcomes are and the impact on the residents, what potential trauma we're inflicting on them. So I'm working to collect some data to really understand these processes and what the outcomes are, the movement, and some better opportunities to make improvements as we go. So Peel Outreach, I've mentioned them a ton because they're really at the heart of our encampment response. They're out in the community every day connecting with residents, meeting their immediate needs, and building trust. We're working very closely with them to make sure that every encampment resident is supported really through every step of the process. They're providing critical supports like harm reduction, shelter referrals, basic needs. I'm connecting on a very regular basis with the outreach managers in order to review resident situations and make sure that we're addressing each individual need. Peel Outreach is conducting resident needs assessments during each visit in order to capture the supports that they're offering. And then I'm utilizing this data in order to contribute to our weekly discussions, site conferences, documentation, and things of that nature. So a big part of our work involves engaging with the broader community and their elected councillors. We're continuing to build communication and understanding through regular meetings, information sessions, and knowledge sharing so councillors feel well equipped. We've developed some tools such as a councillor toolkit, as well as we're developing a ward report to really keep them aligned and ensure that they have as much information in real time as needed to support them and also their constituents. We also are providing, we have a community feedback email that any resident in the community can email and share some of their concerns. This is one of my tasks. I'm monitoring this inbox personally to make sure that issues are acknowledged and are directed to the right people for follow-up. And beyond that, Peel Outreach is playing an important role in community engagement. They connect with local businesses and residents and providing information and directing them to the appropriate channels when any concerns are brought forward. So data. Our approach to data is focused on being accountable, transparent, and coordinated. Each municipality maintains an encampment tracker that's accessible for all of our partners and has information such as the name of the encampment, the location, how big it is, how many residents are on site, any identified risks, and any notes from Peel Outreach. And these trackers are what we use as our main tool for discussions. So what you see here is a snippet from our website. We are sharing all of real-time data regarding how many encampments are active in our communities. This is updated on a monthly basis. So we're sharing all the active encampments in all the municipalities, as well as really being transparent around how many encampments are being removed and cleaned up. So this has been a really great tool so that all residents are aware of what our approach is and what we're doing on the back end. So some lessons learned and key takeaways. We've made really significant progress in strengthening our coordinated response, but of course there's always room for improvement. So one major challenge that we've experienced is ensuring that our implementation is consistently aligned with our established protocols, especially as new partners are coming on board or as practices evolve. Open communication, of course, remains critical, but it can be complex with multiple partners who are involved, each with their different mandates, timelines, and pressures. So the pace of progress also is impacted when partners have different levels of available resources, and we hope to address this in our budget request to have more staff on board in the new year. And finally, I just wanted to mention the pace of work. So there's an expectation to move quickly and resolve issues, but it's really important that we balance that urgency with thoroughness and due diligence to ensure that our responses are effective and equitable. So ensuring that we're aligned with all of our partners has really been at the key to all of the work that we're doing. So some strategies for success. Why is this not? Yeah, so community-based policing. We have Peel Region's Police Community Mobilization Unit who supports us in our encampment response and attend the encampments with us. They're in plain clothes. They are not there to be any type of enforcement. They're really developing rapport and relationships with the residents. They help us to achieve more voluntary relocations that minimizes unnecessary police intervention. And their perspective and training really allows them to uniquely assess any health and safety risks on site. As mentioned, data is at the key of everything that we're doing. It has been challenging. There's a lot of data points that we need to capture, so developing tools to do some of that work is something that we're continuing to work towards. Human rights-based approach, so we must be fair, proportional, and respectful. Sometimes targeted enforcement does have a role, especially when encampments are in these no encampment zones. But if we are doing that, it has to be strategic and always undertaken with alternatives. And of course, shelter options are critical. People need somewhere to go. Adequate shelter capacity is essential for any suitable solutions, and ensuring that they're also low barrier. Together with these strategies, it helps us achieve success with a balance of compassion and effectiveness for community safety in our encampment response. Okay, you're gonna take it home?
Let's go Blue Jays. So, as mentioned, we have some next steps. This project is not quite done, so we are completing our standard operating procedures, as we've mentioned. We're creating training materials to support staff and staff turnover. As you all know in this room, if someone leaves the role and a new person comes in, there's a steep learning curve expected of them. So we're trying to support staff in those environments as much as we can. There's a lot of stress. For example, when Cassandra first came to us, there was a lot of stress put on Cassandra to immediately understand a project that the rest of us had been working on for many, many months, but she's doing a fantastic job. We're finalizing performance metrics to monitor the effectiveness of our response. When you're living in a fishbowl, you need to be able to show how things are working. We will execute our MOUs with everyone. That's an important public display of collaboration. They're non-binding, but it's still very significant. We're transitioning our working group, now that the project materials are almost done, to more of an operations group with a mandate just to monitor how things are going in Peel and maintain the relationships that we've built over many, many months. Getting sufficient budget from our regional council at the end of this year will be critical to our success, because this is a new response and we need new resources to fully implement it, so we can start talking about service times and assess expectations accordingly. And our local municipalities are amending or creating bylaws as appropriate. This is essential to the ongoing success of our response. Clicker is not working. I can do that. Success. So just our final thoughts on behalf of many, many people. We are working together to compassionately lead a very difficult response in Peel, and we all are contributing to solving unsheltered homelessness, one resident at a time. We really, really believe that. That's what keeps us going. It's very hard work, but we hold ourselves to that. It's a combination of operational commitment, strategic oversight, and compassion, and it is resulting in better housing and community outcomes, including upstream solutions. We have been looking at what happened with folks in encampments before we had our response versus now, and we have much better results. And we know what those results are. So we know it's not perfect, but we're moving in a good direction. We're very thankful for the continued support, investment, and engagement by all of our partners. It's difficult to keep that going. It's okay. Dynamic partnerships allow us to all remain engaged and share insights. So we're all bringing something to the table. We're all there for a reason. We're getting our needs met, and we're continuing to build trust and respect. Together, we are building safer, more inclusive communities where we feel all Peel residents have access to stable housing and support services. And as we say at Peel, we are building a community for life. Thank you very much for your attention today.
Good morning, everyone. Nice to see you all. I hope you've enjoyed the last 3 days of learning, educating, and really connecting with each other and networking and learning about the impact that we're all making across Canada in homelessness. I'm Ryan White. I am the program manager with LOFT Community Services. We're here today to speak specifically about our multidisciplinary outreach team, which is also known as the MDOT team. Sorry. Presenting is not one of my fortes, but we'll make it work. Clicker does not work, sorry. Do you want that? Okay, so a little bio about myself. I spent the last 20 years working in the vulnerable sector with marginalized individuals in the homeless sector in various acute settings, hospital settings, community-based settings. And I'll just pass it over to my colleague who's going to introduce herself as well.
Thanks, Ryan. Hi, everyone. My name is Jenna. Pronouns are she and her. A little bit about me. I am a registered social worker. I've worked in this field for the last 10 years, supporting individuals and working in programs with folks who have complex mental health and substance use issues who are experiencing homelessness. When I introduce myself, I always reflect that my first job ever in 2016 was a housing worker, where the first person I ever housed was a bachelor apartment in downtown Toronto for $850. And if you know anything about Toronto rents, you can't get a room for that price. So it makes me reflect on how things have changed in the past 10 years. And I'm currently the program coordinator of the MDOT Outreach and MDOT TTC teams at LOFT. So for those of you that are not familiar with LOFT, we're a pretty big organization. We have over 1,800 supportive housing and transitional housing units. We, in the last year, supported over 20,000 individuals. We have 3 streams of services. So we have our supportive housing stream, complex care. So that's really for individuals that are living in a 24/7 setting of support that have PSW and other healthcare supports embedded where they live. And then specialized services, which we'll be talking to you about today. We will be highlighting our programs that are in Toronto, which is covered by Treaty 13 and the traditional lands of the Anishinaabe, Haudenosaunee, Huron-Wendat, and Mississaugas. But we do stretch all the way up to Penetanguishene, which is what we call our North programs. And that covers the Williams Treaty, Treaty 18, and is the traditional lands of the Chippewas of Georgina Island, Chippewas of Rama, Mississaugas of Scugog Island, and Mississaugas of the Credit.
Thanks, Jenna. So we're going to talk a little bit about our Front Street mental health and homeless services. In our Front Street services, we provide services to those who are particularly hard to serve and engage with. We meet clients where they're at, whether it's beyond a single interaction, and we're meeting them in the parks, the ravines, the under the bridge, the bank lobby, anywhere that someone is finding shelter. We are there. So we're also in the transit system as well. MDOT obviously stands for multidisciplinary, so we provide wraparound services that are disciplinary care as well. So making services that are. So we are a mobile team. So we do have two outreach vans that allow teams to engage with people directly where they live, on the street, in a shelter, in the TTC, in a hotel during COVID due to social distancing. Hotels were developed in order to support the unhoused population or the homeless population in the hotel shelter system. We do still support people in the hotels. We do have approximately about 4 or 5 hotels that are still supporting homeless people because of the sheer number of individuals that are homeless. Last year's count was approximately around 13,000 individuals that are homeless a night in Toronto. We are a team-based program, so there are a team of case managers that work alongside doctors, nurses, and other community partners. We will highlight our community partners as we go along in the presentation as well. We talk a lot about bringing the services to the individual and using a client-centered approach, and really that means for us is that we are where they are. And so we are connected to hospitals, shelters, drop-ins, housing providers, and other community organizations or agencies that are also supporting the homeless population. We're really, really big on collaboration, and you'll see when we talk about our partnerships, how many partners that we do work with. Too many buttons to push. A little bit about our service philosophy. So hands-on, meeting clients where they're at, both individually and geographically. And so we are a small but mighty team, but we are actually covering the entire Toronto area, north, south, east, or west. We talk about, hear a lot about low barrier access to services, and that's why we're here today. We really pride ourselves on low barrier, and when we talk about low barrier is that, yes, we can accept a referral, and we do have a referral, but we'll also just speak to individuals, and maybe we just have their first name, maybe we have a date of birth, maybe we have a location that they hang out at Queen's Park and they're wearing gray joggers. We will take any information that our partners from the City of Toronto who do street outreach and take that information and try to locate the individual and engage the individual. We certainly use a harm reduction approach with individuals. We see probably about, I would say, a good 90% or more or higher of individuals that do have concurrent disorders. It's challenging right now with the closures of the safe injection sites, but we continue to work from a harm reduction lens. We're very much recovery focused in using a trauma-informed care approach with all of our individuals. And we really spend a lot of time teaching and training our staff what it means to work from recovery and what it means to be trauma-informed as well. We're prepared to engage with individuals with complex needs. And so these are the individuals that are falling through the gaps, maybe have been hospitalized 10, 13, 14, 20 times, who are hard to engage. Sometimes our engagements, we can build quick relationships in a couple days, a couple weeks, but we've had also interactions where we're trying to build a relationship and trust for over a year. We may go back to the same bus stop over and over and over until that one day they decide to engage with us and engage in their recovery. All of our work is supported by evidence-based practices. So if we look at some of our key engagement strategies, you can see the outer circle is consistent and persistent. We try to engage the individuals a couple times a week. If one day doesn't work, we'll try another day. Sometimes our engagement is to build trust and working relationships. As I said, it's taken about 6 months, sometimes up to a year, due to their entrenchment in their homelessness. We've talked a little bit about flexible and low barrier service. We focus on relationship building and trust and really meeting the individual where they're at and really truly living in that. And so, if an individual, sometimes in case management services, people miss visits, and there's a certain threshold of missing visits before we have to make it, before people decide the client isn't interested in the service, or because of operational pressures or program guidelines, the decisions are made to discharge the individual. We really try to refrain from discharging individuals because we know that the complexities of the clients that we serve, the transiency of the individuals, and also really truly understanding their entrenchment, and also understanding that clients drive their care. We are there to support them, guide them, mentor them, provide them resources, but they are an individual, they are a human being, and they are allowed to drive their care. and we spend a lot of time talking about allowing clients to live at risk. They are allowed to make decisions. They are allowed to use drugs. They are allowed to engage in whatever they choose to want to engage in. We may want something different for them, but that's not our responsibility. So when we look at the benefits of a multidisciplinary approach, we are a specialized service team that's on the streets, in the shelters, in the transit system. I think one of the key important factors to our multidisciplinary team is that we have immediate access to psychiatry and nursing. So our teams are developed with a team of case managers, nursing, and psychiatry. Our psychiatrists go out to the individual. We're not asking them to come to the office. We're not asking them to book a time to come to meet with us. Our psychiatrists are riding their bike to the ravine. We are driving them in our street outreach van. We are going to them. The nurse is attached to the case manager. The nurse is going out to the ravine to meet them where they're at. The wound care may be that moment in time interaction, and really fully encompassing bringing the specialized service to them. The strengths of each professional discipline working collaborative for each client served. This is really a strength in our partnership, and I think we've been very strategic in aligning ourselves with other partners who also have the same values, aligned missions, same view or perspective in how we treat, support, and engage individuals. We break down silos. Both addictions and mental health case management expertise are available to clients. And so one of the things that we've acknowledged that in our specialized services is that we have a focus on mental health, and we do have specialty in addictions. But sometimes it's understanding what our thresholds and limitations in supporting individuals, and then making the right decision to connect them to the most appropriate care. And so one of the things that we have understood in the population that we serve is that we do see a high volume of individuals with concurrent disorders or obviously addictions. And so we've partnered with the Toronto Community Addictions team, who also is a specialized service in addictions. And we meet on actually a monthly basis to talk about individuals that may be more appropriate for the Toronto Community Addictions team. And they also talk with us with individuals that they're supporting who may have more of a mental health component to it, and being able to work on that shared care model with each other, and understanding that we value each other, and understanding that we all have specialties within our tool belts and teams. We're big on advocacy. As we know, individuals have been have stigma, have been turned away from services, have been declined services because of their history. And so part of our role is really about advocacy. And as we move people out from encampments to into housing as their choice, there's a lot of stigma attached to that. And we have to dismantle some of that in the work that we do with the housing operators. You know, we have a lot of housing systems that have these definitions of high, low, and medium support. But what happens when the individual is deemed high support, but the housing operator is declining that? Where does that individual go? You know, and so we're really focused on the advocacy piece of understanding that everyone obviously deserves a right to housing, and everyone needs the most appropriate level of care and support. Talked a little bit, we provide psychiatric and medical assessments, consultations, access to treatment, service planning, and advocacy on one team. And so I highlighted a little bit earlier, we're a little bit of a small and mighty team, and I'll talk a little bit about the breakdown in the team in the coming slides. Why this approach works. We have multiple touch points and interactions with clients and their identified support teams. It's a positive effect because we are seeing a number of days spent homeless has been reduced. There's reduced time spent outdoors in the streets or in the shelters or the transit system. We see a reduction in psychological symptoms because of the connection of the psychiatric care that we can provide. We see a reduce in substance use, and we see some housing stability. And the findings suggest care needs to be continuous, community-based, and intensive to maintain and maximize client potential. I'm going to go one slide forward and talk first about MDOT, our multidisciplinary outreach team. It is a team of, so MDOT multidisciplinary outreach team is made up of specialized case managers, a registered nurse, a housing worker, a psychiatrist, a peer worker, and a concurrent disorders support specialist. Within our kind of MDOT umbrella, we have three components of our team. So we have our MDOT outreach team that works from 9 a.m. till 11 a.m. And that team is PM, not just 2 hours. And that team really is a specialized service that is supporting people who are sleeping outdoors. We have our MDOT outreach team that is supporting individuals that are in the hotel and shelter system and are obviously homeless and are presenting with mental health and complex issues. It is also a multidisciplinary team, and so we have a psychiatrist that supports our MDOT hotel team, and we are partnered with approximately about 14 hotel and shelters in and around the Toronto area. Very informal, but it's a service that we provide, and we meet with those hotel shelters on a monthly basis to talk about the individuals that we're supporting, to support the continuity of care, and making sure that we're sharing what each individual can do, because the staff in the hotel shelter are there for 24 hours a day, 7 days a week. We are a community-based program, and so we really leverage their support and information and expertise to support the individual together. We do have our MDOT TTC team. We're almost into our third year. It continues to be a pilot with the City of Toronto and the Toronto Transit Commission. And so approximately about 2.5 years ago, when out of COVID, we can see that the homeless population is accessing the transit system for shelter and warmth. And so we've been on almost a 3-year journey of that. And we're currently also in the research phase of that pilot. So I'm going to go back to another program that I oversee, which is Coordinate Access to Care from Hospital. It's a partnership program created in 2010 to reduce hospital visits and improve coordination access to care from homelessness individuals who frequent the ED and the inpatient units. It is based on a critical time intervention model, and it talks about wraparound service, multidisciplinary support, and really engaging in the individual intensively for a year. It works from a housing first and harm reduction model, and again, multidisciplinary and big on partnerships. So we have access to a family physician, a psychiatrist, intensive case management, and a nurse practitioner. We have a weekly clinic for individuals that are referred from the hospitals to us, where they can access the medical clinic as I identified on a weekly basis, and it's in one of our shelters that we are partnered with. We talk about it being short-term, or we talk about it being transitional, but we all know here that the systems are completely overburdened. And so as much as we're transitional and short-term, we make sure that we stay connected to the individual as long as they stay connected to us, and making sure that we connect them to the right level of support and services, whether that happens within 3 months, 6 months, a year, 2 years, or 3 years. We will stay connected to the individual wherever they move. So we talk about who is eligible for our services. Anybody who is 18 plus experiencing homelessness in the city of Toronto, any individual who has serious mental health or substance use challenges, living with cognitive impairment, diagnosed or undiagnosed, because we will work with them to look into that further, living with acute or chronic medical illness, which requires intensive support, has difficulty accessing office or appointment-based services with other community services. And I think this is really important to highlight because we are a multidisciplinary team, and sometimes we do provide high-level support and services and engagement, and sometimes we get referred to as an ACT team. We are not an ACT team. We will transition individuals to that higher level of support, but sometimes we also see that individual, our approach and service model delivery may be different than the ACT. And I think that's more about us going to to the individual, and sometimes ACT teams also want the individual to come to the office. And that's a challenge for people to engage in service, whether it's about the transportation needs. If I don't have somewhere to sleep tonight, am I prioritizing looking for somewhere to sleep tonight than going to try to get to the office at 10 a.m. to meet with somebody? We support individuals who are not connected to psychiatry as well. And as I highlighted, not connected to an ACT. Now, how do we do all of this? With understanding that longer term services, there's huge wait lists on coordinated access. And so LOFT has wonderfully designed the MATCH team, which is multi-access to care and housing. It works with individuals who have newly exited homelessness, whose health and housing needs are stabilized while working with CATCH and MDOT. MATCH, it provides long-term interdisciplinary care, including case management, psychiatry, and nursing. And so this is a key to our success in being able to always have our doors open to referrals, because we have that flow through and have the ability to work with individuals and stabilize them, move them into housing, and really support them in that transition from homelessness to housing. And we really work with the individual in making sure and supporting them in that there's not a recidivism back to the system. I think we really need to look at with understanding that all of our systems that individuals access are overburdened. And we're providing statistics and data about the impact that we're making. But in the long term, I think we need to look at what is the recidivism back to the system, because the system is already overburdened. And how do we support individuals to maintain their recovery, maintain their housing, maintain their substance use if that's what they choose to decide. I've done enough talking. I'm going to pass it over to my wonderful colleague, Jenna.
Thanks, Ryan. And I'll just add, MATCH is an internal referral program only, and it's great. We all work in the same office, so we can quite literally, I will walk myself over to the program manager, we will have a conversation about the individual, and it also goes the other way as well. So if a person on MATCH has lost their housing for whatever reason, and the case manager doesn't have the capacity in the moment to do the level of intensive outreach that our outreach team does, we will take them back, restabilize them, and then transfer them back to MATCH, often with their same case manager. So that continuity of care piece is embedded in everything that we do. So as Ryan mentioned, we have a bunch of community partners because everyone in this room knows you can't do this work alone. And so our MDOT outreach program is funded by the City of Toronto, the MDOT TTC team, of course, TTC, and Hotel by Ontario Health. But we work very closely with Inner City Health Associates. They are our partners with psychiatry and nursing. They are also embedded within the shelter systems. They are a group of physicians and nurses that specifically supports individuals who are currently or have histories of homelessness in Toronto for healthcare. CAMH, Scout, Dixon Hall, Good Shepherd, the list goes on. But we have some really fabulous partners that we work really collaboratively with. Okay, so now we're going to tell you what we're up against, if we haven't already hammered that home. But specifically, this is really what the team has told us and what we're seeing in the trends. So no surprise, the lack of indoor spaces and housing. So as Ryan mentioned, I think the count was 13,000 or 16,000 people a night are experiencing homelessness in Toronto, and it's about 1,300 encampments, I think the last SNA in the city of Toronto. We do not have enough shelter spaces for individuals, and we have a lot of folks that do want to go inside. It's really challenging for our case managers when they're building trust and rapport, and they just know if they could get someone inside, that would enhance the relationship. And it's really challenging to walk away from someone when you've called central intake, when you've called kind of our backdoor avenues that we have with our partnerships, and you still can't get someone inside. Or the options that are there are a cot in a very brightly lit room with 100 people. That doesn't always work with people with really complex mental health issues. And also, we do have access to the COB subsidy, which is a subsidy for Ontario. The outreach stream, which we're part of, only gets 2 a cycle, which is 2 subsidies every 3 months for market rent. And that subsidy, actually, the funding is done for this year. So fingers crossed, year 7, it'll come back, which is April 2026. So that's a significant limitation because this subsidy does allow us to house people in the private market. We've seen a huge increase of seniors coming into service or being referred. When I started on this team in 2019, very rare to get someone referred in over the age of 65. Now, part of my role is I triage all our referrals. Weekly, I'm getting people 65, 70, 80, 85. We're often not the appropriate service. If you have geriatric mental health concerns, you need a geri psychiatrist. Our psychiatrist, that's an additional specialization. We make it work, but it's a population that we know is rapidly aging, and we don't have enough specialized psychogeri services for these individuals who have a variety of different complex needs. Increased wait times for services that meet the needs of their clients. So we're a transitional service, as Ryan mentioned. Sometimes folks are with us for 6 months, sometimes they're with us for 5 years. We've stabilized them and we're waiting on the ACT team to pick them up or the appropriate service that they need to be referred to for long-term services that have really long wait lists. As Ryan mentioned, Match has been amazing in terms of the flow that we're able to create. And there's often a resistance to take folks who have complex needs, who are experiencing homelessness. We have wonderful programs that are not catchment based. Everything else is catchment based in Toronto. And the thing about folks experiencing homelessness is there's a lot of transientness. So it can be very challenging once a person's name comes up in Etobicoke and they're now living in Scarborough and having to do a lot of advocacy, or they have to remain on a wait list until they're housed. And of course, ongoing issues with connecting with primary care. We do have some really good partners in the downtown core, but we find when folks move out of there, it can be a bit of a challenge. Harm reduction, as Ryan mentioned. So if you're familiar in Ontario, our lovely Premier has pulled some of the funding for the safe consumption sites. We have 2. One is closing next month, and we have 2 left. And the safe consumption sites were really great hubs for case managers to find their clients. A lot of our clients don't have phones, but they have amazing, incredible staff that are working in these spaces that connect with the teams, or we just know that that's where they're going to be. A lot of these folks are on safe supply. They have to go multiple times a day. And so it was a great place. And we've seen the amazing work that has happened when we can go to these spaces and find our clients. And second stage eligibility criteria, as Ryan alluded to, often we have clients being approved for city-funded supportive housing, which is great. And then there's a second stage eligibility where if you know anything about supportive housing, the housing provider gets kind of the final decision. And often, sometimes their needs are deemed too complex and they're declined despite our very good advocacy. And it's challenging because where do you go, right? You know a person needs supportive housing. And so you're kind of back at the drawing board. And also, you have a client that is now being dragged through this process who maybe thought that they were going to get housed only to be declined. But it's not all bad. We do have some successes. So despite our housing challenges, we continue to be able to house folks with really complex needs in appropriate settings, whether it's supportive, transitional. We do have folks that move into RGI, Toronto Community Housing, via rapid rehousing programs. And we do have folks that move into private market when they have access to subsidies. We continue to coordinate and transition really complex folks to ACT, ALC placements. We recently had someone go to long-term care, which was, I think, a first for our team, but took a lot of coordination, but he is living there. Successful transitions to match. And we continue to transition a lot of folks from the street either into shelter or into housing. Encampment support, so we are one of 7 city-funded outreach partners, and we are the specialized mental health outreach team. And so we do provide all of the support to encampments, especially when there's an encampment action or clearing. We will be on site to support the residents there. We also have multiple residents throughout multiple parks and sites in the city. And we support what they call the enhanced model, where they bring the city-funded outreach partners together to create specialized plans for individuals living in the park. So the different partners do different things. And our service delivery. So the M.TTC program is continuing to expand into our 3rd year. We recently expanded into the evening. That happened in the summer. So we now have 2 outreach workers that are on shift from 3 to 11 p.m. So previously our services ended around 5, which we know people's lives, mental health, substance use crisis happen outside of the hours between 9 and 5. So that's been a great addition. And we are a direct referral to all of our programs. So we don't use a coordinated access system. In Toronto, we have something called our access point. The referrals are directly referred in to myself and to Ryan. We triage them. So it really creates that point of connection. I have conversations with every single referring worker that refers someone in to understand their person, and really make a plan and touch point so that there is a solid connection in the community. Okay, but we like to be innovative to any gaps that we are experiencing. So some of this is stuff I've already highlighted. So increased services on the team. So our TTC team had a part-time psychiatrist clinic. She now has a full-time, once a week, 9 to 5 clinic. We added a psychiatrist on the M.Hotel team. That was new as of last year. And we've expanded our services from 3 to 11. We also have a case manager on the Scout team, which is our partnership with ECHA that provides primary care to folks living in encampments. A lot of us, myself included, are trained with the community tax clinic. So if you know anything about housing, you need to have your taxes done because the housing provider would like an NOA. So we do that in-house. So folks don't have to go to a tax clinic. They can meet with their case manager. Case managers will refer to me. I quickly do a person's taxes and they're good to go. They often also use our office as their mailing address so that their mail is secure and that it arrives in a timely manner. And we also have access to language support through MCIS, ASL interpretation, and as well as language support for clients. Oh, and also the donation of cell phones. So Ryan did amazing work and was able to secure, we were able to get a donation from a private donor that secured over 100 cell phones with a prepaid plan for over a year with our partners at Chatter. And it was transformational in terms of the supports and the engagement and the connection to individuals. The case managers, we're out of them now and we're hoping to get them back. But it really changed the game for us to be able to connect with our clients and giving them a cell phone. Okay, I'm being told time. We have lots of partnerships. We also value staff wellness. We have a partnership with the Peach team. We know that frontline staff experience a lot of grief and loss, especially in the day of the overdose crisis. And so we have a commitment to supporting staff through these process as well. Quickly, success by the numbers. 825 referrals into the program, over 1,200 individuals served, 159 individuals moved into housing, over 23,000 case management contacts, face-to-face, non-face-to-face, 101 clients engaged with psychiatry, and that was 619 unique encounters, 81 clients engaged with nursing, and over 577 client encounters. I'll quickly give Jay's story. Is that okay? Okay, I'll do this really quick because I think it paints a picture of basically everything we've just talked about with an individual that was in our program. So Jay came into service in 2019 via the Catch team. She'd been experiencing homelessness for 10 years prior, frequently in the emergency departments. And around 2020, the case manager came to me and said, listen, I don't have the capacity to do the outreach that Jay needs. Can I transfer her to MDOT Outreach? I said, sure. She was transferred over to us. We followed her for 2020 to 2023, in and out of incarceration, shelters, hospitals, streets, you name it. But we continued to follow her across Toronto. She met with our psychiatrist, our nurse. She had a period of stability in a shelter. Unfortunately, in August 2023, she did have a significant long-term hospital stay due to an injury, and she was in hospital from August to January 2024. But within that time, she went to a rehab center. She's now using a wheelchair full time. We were able to transition her into our transitional housing program called Back to Home Weston, as they had a transitional space available where she thrived, and she lived there for a year and did incredibly well. And she then, in January of this year, moved into our Path Home program into permanent housing, and she's has her own room, has support 24/7 on site, psychiatry, nursing, PSW, and we transferred her care there. And most importantly, she reestablished a connection with her son, who is her pride and joy, and he comes and sees her weekly. Thank you.
Thank you. And I'm really glad you took the extra time to share that story, because what a great way to end a presentation. Thank you. Question period. So questions for Peel or Toronto. You can go right to the microphone. Mic support in the middle of the room, please. Go ahead.
Hello. Okay, I think it's working. This question is for the LOFT team. So I'm from Toronto. I work for the Maytree Foundation. We support homeless initiatives. I actually think you're one of our grantees. Anyways, my question is, you mentioned that when encampment removals happen, you're there on site to support that. A few years back, there was a really publicized incident at Trinity Bellwoods, really awful violence occurred. I was wondering, in situations like that, how you deal with the city, especially when you have the mayor kind of defending what happened. So I was just wondering, what's your role in situations like that? Are you responsible for de-escalating? How do you support encampment residents? Yeah.
Oh, is it on?
Yep, so I remember 2021. We were not involved in those encampment removals. There was 3 sites. Out of those sites, I know the Ombudsman did a report and made recommendations to change how Toronto responds to encampment clearings or actions, and that's what the enhanced model is, and that's why if it is gearing up to be that way, we do work collaboratively with the encampment office. They take the lead with any enforcement. We are not an enforcement team. So anything, we're very clear on that, and they respect our positionality on that. So we're there to support the individuals. We often have clients who we're already connected to that are receiving service. And we have conversations with them because not always, but often the residents are told that this is where things are heading, especially if they're in an enhanced site. So Dufferin Grove was the last one that was the enhanced site, to prepare them for that. The last time the Dufferin Grove clearing, I think, was 2 weeks ago, we had a rotation of staff going through. I happened to be there the day when the actual action clearing happened, and I was there just doing crisis support and moving around with clients that it was already known to our team to chat with them, but also giving them their space because they have their own community of individuals that they're engaging with and how they're going to move through the encampment clearing. So we're really just there to provide that support. And if there is crisis support, we are there and trained to be able to do that for that setting. But we are not an enforcement-based team, and we've been very clear with them with that, and they've respected that.
Yeah, and I want to be clear that we're not defending an encampment clearing by any means, that we're there to really support the individuals that we provide services to make sure that their mental health is being monitored, and to provide any resources that we possibly can to support them, because it's happening. So how are we there to ensure, and they're our priority, not the clearing. Just want to make that clear.
Thank you.
Want to introduce yourself, Sarah?
It's our associate director.
Okay, we have a question over here and then right here, so I'll pass the mic around. It might be faster.
Hi, just want to say thank you for your human rights approach and how you're dealing with these people. My question is, when you have that list of no encampment zones, what zones are actually allowed then that are actual, I don't know if it's regional or city or however that is, but that's not private property? Just out of curiosity, because I'd really like to go back to where I live and try to say, look at how they're doing this, because where I live, they're really running over human rights, but then they're going to see that and they're just going to jump on that part of it. So,
It's a great question. We were talking about how to balance expectations between like letting all encampments stay forever and getting rid of them as soon as possible. So the no encampment zone concept was something that our working group worked on for many months. And we did talk about, so if we have no encampment zones, can we recommend places where people should go? We don't do that. The amount of community opposition that would erupt if we took that approach. We provide guidance to residents about you can't be here, but you'll need to find somewhere else to go. We can't recommend a specific spot to people because then that'll just trigger that counselor in that community. So it's a delicate balance that we try to have.
okay, and I'm not referring to like recommending, but then is there actual places that are not private property that there have been people camping that you haven't had to go and say you have to move?
So
Maybe that's it.
yes, but again, the region doesn't own any of these government public lands where people are living. So we can only support our clients at the site. If the municipal property owner decides they want to remove and it's not in a no encampment zone, according to our response, they have to meet a really high threshold. And there may be instances where we don't agree, but we will always be there to support the clients.
Thank you.
Hi, this is a question for the PO team as well. I work in Abbotsford and we do a lot of work resisting decampment, and the city uses a lot of language around human rights and empathy. And it sounds like a similar situation where decampments are happening while shelters are full, while there's a long housing wait list. And I'm just confused, like, how is that a human rights approach when we know that right to housing like is literally a human right in like the 2019 National Housing Accord? So yeah, if you could just explain how you use this language of human rights when decampments are happening with no housing options being offered.
We do have available shelter space. So Peel has a do not turn away policy. I know it's not the same as housing. We do manage to get some folks into housing, but it's very, very hard to find housing opportunities. But we do offer shelter. So having an option to go to shelter is a very important part of the process. If there's nowhere for them to go, then we should be doing that. Peel has a do not turn away policy, so any Peel resident who requires shelter, we will make it work for them, and we don't have to turn anyone away.
So there's, like, if there's not shelter available, decampments don't happen, or Peel just has like an abundance of shelter? Because in Abbotsford, they'll say shelter is offered, but then you like call the shelters and like there's literally no shelter space. So that doesn't happen in Peel?
It's an interesting dynamic because Peel doesn't have encampments on our lands. So it's not Peel's ultimate decision whether or not to remove the encampments. But if we decided not to participate in supporting the residents there, then they would suffer. And so we work really hard to minimize the trauma that they will have from moving. We also try to delay, Cassandra was talking about how we try to delay and extend the removal date as long as possible to get folks into appropriate indoor options. But it is a very difficult situation for us because we report to our regional council who provide us with guidance and direction. I see a lot of heads nodding in the room. Like it's a very difficult situation. So we're trying our best to have a balanced approach, but we always keep our clients focused right in the center because their needs outweigh everyone else's.
Can I just add to your question? I think when we look at encampments, and understanding that encampments can pop up anywhere and everywhere, whether it be in a park, under a bench, whether it be on the TTC property, or even on the Metrolinx property, which is also known as GO Train. What we've realized over the time for the work that we've done is if we use the transit system, TTC and Metrolinx, they're really about moving people. They're a transit system. And so some of the work that we've done with our partners and our funders is, and no fault of anyone's, is their understanding of the individual that has popped up an encampment, or understanding why the encampment is here, and making sure that we're partnering with people that understand the work and can teach each other. And it's not about ignorance. It's the TTC is about moving people, but we are about supporting people who are choosing to sleep outdoors. And so, how do we teach each other to understand the systems that this individual is using, and also why they are there, is helpful for people who are not in the work that we do. Does that make sense?
Yeah, and I just wanted to add, we had a court case in the city of Abbotsford this year, and the judge did declare that decampment without the offer of housing or harm reduction services that were adequate is a human rights violation. So just, you had to be clear, like a decampment without housing being offered is not a human rights approach.
Yeah, so I just wanted to add, so we make sure that we have shelter space available when there is a removal. So there is no situation that we're removing without shelter space. We have a dedicated hotel for encampment residents specifically, so we always have space. Again, I work very closely with outreach. If they have any issues with getting into shelter for encampment residents specifically, they call us, we escalate, and we get them in. So that's something that is very important to us. Maybe that's not available in your community, but yeah, we always ensure that we have at least shelter space.
Thank you.
Hello there. I just want to say I have mad respect for you because I know it's hard to develop something such as an encampment response in a time of uncertainty. There are going to be missteps, but there's also going to be successes. So keep leaning into those successes. Keeping in mind, trying not to contribute to the criminalization of homelessness. Number one, I'm curious what the threshold is specifically that would incite an encampment removal. And then in that process, when the trespass order is issued, how is it ensured or supported to ensure that they do not go against that trespass order, criminalizing their acts?
Who do you want to answer?
Peel.
This is a really hard question for us to answer.
Same here.
Can you repeat it again?
What's the threshold that would create the need to remove an encampment? We'll start with that one.
So we aren't privy to internal discussions where there might be a decision to remove. We have very high thresholds around health and safety risks where we agree as a team to come together and discuss, and whether or not we can agree that these risks can be safely mitigated. If they can't, then that could start the ball rolling to say, you know what, we collectively think that it's better to work with the residents to move them to safer housing options. Sometimes internally, there may be other dynamics at play, and a removal is requested. In those cases, we would still, as Cassandra said, work very hard. So our focus is always on the client. And if a removal is going to happen, then we will make it work and give them the resources. But there has been instances where we're discussing as a team and we don't recommend proceeding. But at the end of the day, we're not the property owner, but we still want to support.
Thank you. Let's say an encampment sets up right outside your office on your property. What threshold would incite the removal of that using your risk assessments?
Well, we have a number of risks, and we can share with you our site assessment and our needs assessment that categorize all the risks and the threshold of risks. And we have developed a risk matrix, and it allows us to objectively assess in real time those thresholds of risks. We had an encampment outside of our office a few weeks ago, and we worked closely with the residents to get them into shelter, right, Cassandra? Yeah. So, but we weren't trespassing them.
Great. In the typical process when the trespass is ordered, I know it's a property rights issue now. How does it not step into the criminalization?
So, Devin, do you want to answer? We have our lovely outreach team here. One of our managers.
And just to let you know, we have 4 minutes left for questions.
I can make it really quick. One of the things that we learned from the outreach perspective, hi, my name's Devin. I'm one of the managers of the outreach team. So the trespass orders actually serve to the encampment, not the individual. So that helps with the criminalization aspect, which is really, it's good for the individual. It doesn't criminalize them if they're in the encampment. So if you're set up in the encampment outside the office and it's served to the encampment, it's never served to that individual. The encampment itself is the criminalization. So the encampment has to be removed from that park or the location that it's served at, and it'll be on that trespass order, the location and the square kilometers or the square footage will be outlined in that encampment, in that trespass order. Then if they return to that property and set up an encampment again, the encampment will then be trespass ordered again, but the individual is never trespass ordered. And it works in the same way that that individual is allowed to return to that park. So that's helpful as well. It's the individual is never going to be trespassed from that park and not allowed to return. Unless if it's something separate and they're criminalized for something separate, then they can receive a ticket.
And I just think my name is Leslie Morrow. I'm manager in housing services at the region. I think one other important point is Peel Regional Police has been a very important partner and on board with the encampment response, and they use their non-enforcement arm. So I think that's a really important piece too, is their commitment.
Thank you. We have 2 more people patiently waiting for this microphone, so I'm going to pass it on, and then we have 1 more.
Hi, thanks for your great presentations today. I appreciate all of you. I just have a kind of generic question for both teams. I think the only thing I didn't hear a lot of is talk about working with people with lived or living expertise or peers. Do you both have that somehow enmeshed into your services and or your protocols? And I just because I know we're running out of time, just a really brief explanation of how you do that.
Yeah, so we at Front Street, because that's where our mental health and homeless services are, we actually have 3 peer support workers that are embedded in our Front Street services. And they are available to the case manager, but also, for peer accompaniments, appointments, connection to another individual that has lived experience. And we value their knowledge and their expertise in engaging with the individuals that we support. And so it's one of the services and supports that we certainly talk about when we do intakes or when we engage with individuals, that this is an opportunity to talk with somebody else who has also had lived experience.
Thank you.
Very quickly.
Yep.
We have regularly engaged with people with lived experience throughout the development of these materials, and we take them back and get feedback from them. We have kiosks at our shelters, at our shelter specifically for encampment clients, where we ask them specific questions and dialogue with them. We will continue to do that work on a regular basis because it's important to get their feedback. But also in our 2026 budget, we are implementing a peer supports program through one of our community service providers who has been at our working group from day one. And they will be working closely with us and with our outreach teams. So we're really excited about that program because we know that we need it.
Thank you. Last question, and we are at time. So if people do have to step out, that's fine.
Run away quick. So just along the same vein as that, actually, you made a comment, this is for the region of Peel, you made a comment about the weekly encampment meetings and how all of our experts are brought together in those meetings. And so my question was, how are you engaging current residents of the encampments at those tables, because those are the experts on that situation? And so I'm just wondering how many individuals from the encampments are sitting on those tables.
That's a great question. We are using outreach as our conduit between the communications with encampment residents directly. So they're providing what their needs are and bringing that to us. And we're also having the HSWs, the housing workers, and outreach. We're having case conferences to discuss what the encampment residents' needs are on a more weekly basis to address whatever their needs are and identify the gaps and barriers that they're sharing.
Okay, so lived experience experts are not at those tables.
Not at this time. Thank you.
Thank you very much to the presenters, to everybody here today. We could talk about encampment response all day long. It's such a big topic, and it's a thing we're developing and learning and changing and learning every single day. So thank you for your time today.